All right, we are ready to get started. Hello, everyone. My name is Heather Hayes. I am the Associate Director of the LA General Medical Center Foundation and the Wellness Center. And we are so excited to be welcoming all of you to our March Health Innovation Community Partnership monthly meeting. Let's go ahead and get started. Okay, as we get started, just a reminder that this meeting is being recorded and the meeting and all of the materials will be posted on our website, hicpla.org, in about a week's time. We have a virtual and in-person opportunity to participate in our meeting. So we have a lot of guests on the Zoom as well as guests in the room with us. We want our meetings to always be interactive. So we're going to give you plenty of opportunities to raise your hand, ask a question. You can type it in the chat and we'll read it aloud at the right time. Or when the opportunity comes, we'll ask you to raise a hand to participate and ask your questions. We also want to remind everyone that our meetings are interpreted in Spanish, both on the Zoom line and in person. So for our speakers, please be mindful of the pace of your speech and try to minimize the use of technical language that may not translate particularly well. Okay, with that, let's take a look at our agenda for the day. As always, we'll kick it off with the guiding principles of the Health Innovation Community Partnership. We will then have an update from our medical center partners. Dr. Chase Coffey is joining us here for that today. And then we're going to have a community health update by Cristin, Mondy. And next, we'll move into a report back from the Health Innovation Community Partnership community meetings that we've hosted over the last couple of months. We'll take a quick break to reset, let people enjoy some of our wonderful refreshments, and then we'll come back with a big presentation on transportation. I'm sorry that the agenda, as shown on the screen, is not quite accurate. Our 9:50 presentation is about accessibility on the campus. We have several presenters from various transportation entities that are here to talk with us about how we're making improvements in how you get to the campus, how you transit around the campus, and how we keep all of those spaces safe for our employees and our patients. Okay, I'll read aloud our guiding principles to kick off our meeting. All participants agree to basic principles prioritizing resilience and health, community resilience and health in all programs and projects. All participants agree to approach issues with an open mind, be willing to engage in dialogue, and commit to thinking boldly about solutions. Participants will state views and ask genuine questions. Participants will seek to avoid monologues and arguments, move to conversations where participants are curious and seek to understand various points of view. Participants will explain their reasoning and intent, will share how we reach our conclusions so that others can understand our divergent reasoning. Participants will attack the problem and not the person, organization, or institution. Participants will define key terms so that we can attain a shared understanding. Participants will share all relevant information. Participants will always arrive prepared for the meeting. During meetings, only one person talks at a time. We will not engage in sidebar conversations. Participants will work to develop a comprehensive, common set of information with which to solve problems and make decisions. Participants will jointly design next steps. Okay, and with that, I'm delighted to welcome to the podium Dr. Chase Coffey to present on updates of the medical center campus.
Good morning, and thank you, Heather. Buenos dias a todos. My name is Chase Coffey. I am the Chief Quality Officer and Associate Chief Medical Officer here at LA General Medical Center. And I'm really excited to share with you some of the new advancements in our care delivery here at the medical center. So first and foremost, I want you and the community to know that this is a really safe place to come and receive care. We shared with you this time last year our first ever Leapfrog safety grade of an A. Leapfrog is a private organization that assesses hospitals across the country for their ability to provide safe care. Just like we grade restaurants in their health and sanitation, we grade hospitals along the same line. And the graph here shows just how much hard work we've done over the last 6 or 7 years to achieve a grade A. For reference, we are one of only 7 public institutions across the state of California that has received a grade A. In fact, the other main organization in LA County that received a grade A is UCLA. So we're really honored to be in this company. This is hard work done by our frontline staff to make sure that every patient gets safe care no matter what. Now, here's the fun stuff. We have lots of neat and cutting edge care delivery tools that are coming or have arrived here at LA General Medical Center. Frankly, I don't even know all of the things that are on this slide, but I can tell you they are fancy, they are high tech and cutting edge. And in fact, some of the work that we do here is not done anywhere else in the state. So as an example, lymphedema surgery is a new and cutting edge surgical field that is only done in a handful of sites across the country. Got that? Thank you. We're really excited that in the coming summer and fall, we'll have a specialist surgeon who does this surgery. It's all right. That's right. We are continuing to use robotic surgery techniques for some of our very complicated surgical procedures. This is important because it's a faster recovery time for our patients when they do surgery through robots than through large open surgical procedures. A couple of other highlights on our technology advances. Our interventional radiology team is bringing new and advanced techniques to help treat patients with back pain. We know back pain is a large and painful problem for many patients, and it often debilitates them from working, from taking care of their family and loved ones, or even just being able to walk around the block. So we're very excited about helping our patients get better care for their acute back pain. And last, we have one of 4 burns centers in the Southern California area. And we're bringing a new technique here where we're using laser therapy to help burn scars heal. Very cool stuff. Very few centers do this. And it's particularly impressive that a public institution like ours is doing this level of technologically advanced care delivery. Sorry about that. You heard last month from my colleague, Dr. Banerjee, about our Safer at Home program. This is cutting edge care delivery that actually does leverage technology with mobile phones, but this is really about delivering the same high quality care for our patients in a warm and safe environment that is their home. And who wouldn't rather be at home than in a hospital? As Dr. Banerjee mentioned last month, we have an ever-growing group of pathways for care that we're rolling out. And the goal here is to get people in their home safely to receive the same care and being surrounded by loved ones. Let's try this again. Can you go to the next slide, guys? Okay, perfect. I'm also excited to share with you that we are becoming a more age-friendly organization. And what we mean by that is our hospital needs to focus on making sure the care is accurate for the age of our patients. And as we age, some care is better than others. And we have a new group of amazing physicians who are geriatricians. They are trained in providing care for patients over the age of 65, and they're helping lead the way in making this hospital delivering better care for our patients who are older. You can imagine being older, it comes with a different set of conditions, whether it's frailty with movement, whether it's memory issues or trouble thinking, whether it's trouble seeing. And we are working exclusively on trying to make sure that our patients who are older, who are aging into, who are aging are getting the right care that they need. We're focusing on 4 things: mobility, understanding what matters to the patient first and foremost, their medications, and how are they maintaining their cognitive capabilities? How are they thinking, their memory? How do we keep people sharp? I'm really excited about our cancer treatment programs. We have 3 parts to this, where the first step is understanding if we have a patient that we're concerned about who it may have cancer, how do we rapidly get that patient evaluated for possible cancer? I think we're 1 slide ahead there. Yeah, right here. We call this our Cancer Dash program. So if I have a patient that I find has a mass on their skin, I can refer the patient to our Cancer Dash program. They will get a rapid assessment and workup for potential cancers. And that means going into a clinic, getting imaging, getting a biopsy, so that if we find that the patient has cancer, we can then enroll them in our cancer navigation program. And the goal of our cancer navigation program is to go from diagnosis to treatment within 2 weeks. All right. We don't want our patients waiting around to get treatment for cancer. We want to help them get care right away. And then, of course, there's a lot that happens during cancer treatment where our patients and their loved ones need support. And we have a program called Enhanced Care Management that assists our patients as they travel through that journey of treatment. So we're honestly in love with this new program, this 3-step process. It's helping our patients get the right care at the right time. Now, I talked a lot about care delivery and fancy new techniques, but providing the treatment is only one part of this. After all, our patients are human, and we are very focused on making sure that the human side of healing is part and parcel with what we do. And we have a couple of amazing leaders, Erica Braxton, our Chief Equity and Engagement Officer, Dr. Aaron Storms, our Medical Director for Patient Experience, and Ms. Claudia Mata, our Director of Patient Experience at the Medical Center. They are leading the way and helping us ensure that our patients get a world-class experience along with their world-class care. So what you'll see coming very soon to the hospital room is a poster just like this. It's going to remind our staff to do the following things: to slow down and connect with people, sit down, share your name, introduce yourself, tell our patients what your job is in their care. We'll then talk about the plan of the day. What can you expect today? And what can you expect for your stay here at the hospital moving forward? When will you be able to go home? What can you expect when you go home? What help do you need when you go home? And then most importantly, we're going to ask again what questions you might have and how else we can help you. So if we do anything, this is the most important thing we need to do for the year. So I'm really excited to have had this time to share the advances in our care delivery here, and I'm happy to take any questions.
Thank you so much, Dr. Coffey. Do we have any questions for Dr. Coffey about any of the amazing innovations that are happening here on LA General Medical Center campus?
Hola, buenos días. Gracias.
Good
Solamente
morning. Thank you. I just wanted to ask,
¿quiénes califican?
who
¿Cómo califican
qualifies
para
and how do
esta
you
gran oportunidad?
qualify for this great
Gracias.
opportunity?
Porque
Thank
hago
you.
outreach,
Because
street outreach, y necesito
I do
saber cómo
outreach
comunicar a la
and I
comunidad.
need to know
Gracias.
how to communicate to the community.
Hi, good
Thank
morning.
you.
Thank you for the information and the presentation. My question is, who qualifies for this program? How does one apply? He's part of the community outreach, so he wants to know this information to relay to the neighborhood.
Sure. Which program?
Acerca del cáncer, el tratamiento.
The cancer.
In
About the
regards to
cancer treatment.
cancer.
Fantastic. Thank you for your question. It's a very good question. The vision is that every patient with cancer will qualify. We are in the process of expanding our programming and our staff to meet that goal. Right now, the cancer navigation program supports breast cancer, colorectal cancer, gynecologic and urologic cancer, and GI cancer, so colon cancer and small bowel cancer. More programs will be coming online in the next 6 to 12 months.
And accessing those programs is becoming a patient of the medical center and then getting referrals for some of that
Yes,
additional
exactly.
levels of care.
Correct. And if you have one of those cancers, you're automatically enrolled in the program so that the patient does not need to do anything. We take care of it.
Got it. So this is an additional set of services available to all
Yes.
patients of LA General that
Correct.
meet these criteria in terms of their condition. Yes. Desde que llegué a los Estados Unidos estoy en esta área de Los
Since I
Ángeles.
came to the United States, I've been here in East Los Angeles area. And a question, what to do and how can people qualify if they don't have medical insurance?
Everybody is welcome. First and foremost, everybody is welcome to come get care here at the medical center. The patients who are enrolled in the cancer programs generally are those patients who get their care here at the medical center. And so those are patients primarily with Medi-Cal or who have no insurance. Generally speaking, patients with other insurance, say Blue Cross or other programs, tend to have their care at other assigned facilities.
So for the non-Medi-Cal and uninsured population, is there opportunity to transfer your service to this hospital if you wanted to pursue your care here?
Fantastic question. Yes. There are a couple of ways to do it. Our fabulous folks at the Wellness Center can assist. And there's some paperwork involved in transferring your insurance or transferring care. But if you end up in our emergency room or our urgent care, we can help bring you into the system if you needed that assistance.
Thank you so much for the plug for the Wellness Center. Appreciating that, of course. Yes, I do want to echo that anyone who can come to the Wellness Center, which is located here on the Monday campus in the historic General Hospital, to talk to one of our navigators about the benefits and insurance opportunities available. Our doors are open to everyone. We invite you to come and learn about our services, but one of those are indeed how to navigate healthcare and insurance. So if that's a concern for you or someone that you love, please stop by and visit us. Monday through Friday, 8:30 to 5 at the Wellness Center. We also are available by phone. So we'd love to have you there.
Thank you. We will work on getting a corrected microphone here. Was there another question online?
Yes, I think there's a question online. Jasmine had her hand raised. Jasmine, can you ask your question?
Hi, yes, good morning. I had a question about the Safer at Home program. I am a tenants' rights educator and primarily in the Boyle Heights area. We've been witnessing a lot of seniors who are falling behind on rent and like having to navigate the eviction process, which I think automatically would disqualify them from getting access to this program. And I'm wondering if there's any work that can happen with the State House LA program, like as a partnership for warm referrals and maybe a pathway for those tenants to become patients and then get rehousing support. I know there's developments happening on the campus as well.
Jasmine, thank you for your question and your comment about housing and our older patients, not just older patients, but all of our patients, community members may be struggling to pay the rent right now. You are correct in your observation that Safer at Home program requires a patient to have a home. And it is our one of our criteria to enroll patients for this program is that they have a place to go. That said, we have other ways to help patients who may be housing insecure or may end up needing temporary housing after discharge from the hospital. And that's probably a longer conversation, but we absolutely agree that housing is an issue. Again, our wellness center has lots of resources. If you come into the hospital, if you fall ill or your loved one falls ill, our social workers will engage and we will mobilize as many resources available to you as possible.
Thank you. I'd be happy to follow up.
Yeah, come on over.
Yeah. Yes, I just wanted to echo some of what Dr. Coffey was mentioning, which is the fact that we have multiple facilities coming online here at the Medical Center campus that help provide that kind of consistency of care and opportunity for people kind of that step in where there may be a housing insecurity situation. And that's known as our restorative care village. So we definitely invite you to continue to join us at the HICP meetings to learn more about that opportunity. It doesn't pertain to Safer at Home per se, but it's just this continuum of care for folks that meet them where they're at, depending on their situation, and just ensuring that no one is just discharged from the hospital without a safe place to go or a way to receive the care that they need.
Precisely.
Okay. Do we have any other questions for Dr. Coffey?
Yes, ma'am.
Okay, perfect.
Do I have to have a patient portal to enroll to the general hospital?
Great question. We would love it if you enrolled in the patient portal because it helps you communicate with your doctor and your team in an easier way. If that works for you, not everybody is good with the phones. You do not have to have the portal to enroll in any of these programs. With Safer at Home, we actually give patients a pre-programmed phone. It's a smartphone, it's a Samsung, and it only has 3 apps: a video visit, a messaging app, and there's one other app that I'm blanking on. So we make it really simple. You don't have to be in the patient portal at all for Safer at Home.
We did have one comment in the chat about contact information for the various programs. So maybe we can follow up and get some of that information from you. And we'll send out, for people that are participating today, we'll be sending out an email with the meeting materials afterwards. We'll make sure to include that information as well. Any additional questions or comments in the chat? All right, then we are delighted to thank you so much for joining us today, Dr. Coffey, and let you return to medical services. Thank you so much for joining us today. With that, we're going to, we have another presenter from the Medical Center campus, but he'll be joining us a little bit later in the presentation when we talk about campus accessibility. So with that, we'll go ahead and move along to I invite Cristin, Mondy, who is the Regional Health Officer for SPA 4, to give us our community health update today. We're focusing in on how to ensure safety for all residents of Los Angeles to access healthcare in these uncertain times. So Cristin, would you care to share slides yourself, or would you like to direct us to advance your slides?
Hi, Heather. Good morning. Can you hear me okay?
Loud and clear.
Okay, great. It would help if you guys can advance the slides.
Absolutely. Just ask and
I'm
we
not
will.
that tech savvy, so I don't want to mess it up.
Okay,
While you're doing that, hi to everyone. I can see who's attending online, but I can't see the group. I'm really happy to be here. Like Heather said, I'm the Regional Health Officer for SPA 4, and proud to say that one of the original members for HICP. So I'm going to give you an update on how we in public health, both as a department and also specifically in my division, which is SPA 4, how we're addressing federal actions on immigration and maintaining ties to our immigrant communities. So who are LA County's immigrant community members? More than 1 in 3 Angelinos are immigrants. So immigrant Angelinos have built their lives in the United States, establishing families, communities, and networks. We, I include myself, are indispensable members of communities across Los Angeles County and are woven into the fabric of what makes this county such a great place to live. More than 80% of immigrants in LA County have been living in the United States for over a decade. So we aren't really talking about an influx of new people. Many immigrants have strong family and social ties, but not all of them. There are certain factors that might raise the risk of social isolation, which can cause physical illness and psychological distress. This includes being over age 50 years old, as well as linguistic isolation. To this point, over 60% of the immigrant population are ages 45 and older, and more than 1 in 4 immigrant households experience linguistic isolation. A household is considered to be linguistically isolated when no one ages 14 or older speaks either only English or speaks English at least very well. Linguistic isolation can create other barriers as well, like less opportunities for employment, education, and housing, and more challenges with accessing both physical and mental health care. Next slide. So I want to talk about the barriers that keep immigrants from accessing critical services such as healthcare, nutrition, housing, and employment. SPA 4, or Service Planning Area 4, stretches across central Los Angeles from Boyle Heights to West Hollywood and from about the 10 freeway north to the Hollywood Hills and across to include Northeast LA neighborhoods. LA County is home to 3.5 million immigrants, and in SPA 4, we have the most people born in another country compared to all of LA County as a whole and to the other SPAs, with almost 40% of our residents being immigrants. There are existing barriers to receiving services like language, work permit status, and housing crisis. But what is most relevant here today is the current federal stance in immigration. As we've seen since January 20th of this year, there are some very real fears in our communities about the detainment and deportation of immigrants. ICE has been spotted across LA County in Southern California, stopping to question many people. Go back to the other slide. Yes, the impact of deportation has significant ripple effects beyond those who are at direct risk of removal. About 1 in 5 Angelinos are either undocumented or live with someone who is. Immigrants, especially those who are undocumented, have expressed fears in accessing services lately. The fear of deportation is affecting attendance in schools, healthcare appointments, and other critical resources.
Cristin, I'm so sorry. We're just going to interrupt really quickly. If you could get a little bit closer to your microphone, the volume is in and out a little bit. So thank you so much. Appreciate that.
Okay. Sorry about that. Is this better, Heather?
Yeah.
Okay. So the fear of deportation is affecting attendance in schools, healthcare appointments, and other critical resources across the US. And we're also seeing that here in Los Angeles. The fear of deportation is affecting attendance in schools, healthcare appointments, and other critical resources, including in our public health clinics and programs. Medical has been expanded to include many more people, but it's feared that the rate of insured individuals will go down because of people's reluctance to register for government benefits. Next slide, please. So in California, we have more protective policies than some more conservative states in the US. Statewide, we have the California Values Act, which says that local resources will not be used to assist federal immigration enforcement, and that schools, hospitals, and courthouses are discouraged from voluntarily working with immigration agents. Also, at the state, 3 new bills have just been introduced to keep immigration agents away from schools and students. The Los Angeles County Board of Supervisors reaffirmed support for immigrants in November 2024, which means that the county resources are not to be used for immigration enforcement or assisting federal immigration agents. The LA City Council also voted in November 2024 to declare LA as a sanctuary city, which prohibits city resources to be used for immigration enforcement. That same day, LAUSD passed a similar resolution that declares the district a sanctuary district, reaffirming a decision from 2017 that prohibits district staff from voluntarily complying with federal immigration efforts. The plan also intends to educate district employees on how to handle immigration agents. Next slide. So at Public Health, we have a departmental policy draft that is currently going through legal review with County Council on how to address situations regarding immigration authority presence at public health occupied buildings. This policy is subject to Council's legal team approval, but the current draft declares that buildings that are owned, leased, or occupied by DPH to be accessed only by authorized personnel such as staff, community partners, patients, and authorized persons who are accompanying patients. So this effectively makes DPH buildings private spaces, which would prohibit immigration agents from entering without a valid warrant. We're eagerly hoping that this policy is finalized soon. And then once it's finalized, all public health employees will be trained on what to do if immigration agents come to DPH facility and how they can advocate for immigrant patients and community members. Next slide. So beyond this department-wide policy, our team or community field services that I oversee, we have a long-standing record of working with immigrants, and our longest running program is a partnership with different consulates across the region. For the last 15 years, we have a close relationship with consulates of Mexico, Nicaragua, Honduras, Guatemala, and El Salvador. We have staff who visit each consulate weekly to give health education workshops about critical public health topics. This includes the fentanyl crisis and opioid overdose reversals, hands-only CPR, healthy eating, active living, the importance of vaccinations, and many other public health topics that are relevant to the community. These workshops give people something to engage with while they're waiting for their appointments, and most people are interested to learn about the topics while also hearing about where to access public health services. These presentations are given in Spanish by staff who are familiar with the needs of the consulate's population in an approachable way. The workshops are chosen in collaboration with the consulate staff, depending on what they see and hear as the greatest need from their constituents. Most recently, our staff have been teaching people to recognize opioid overdoses and reverse them using Narcan. Narcan, which is also called naloxone, is a medication that you give to someone who is overdosing on an opioid, such as heroin, fentanyl, or a prescription like oxycodone or tramadol. It saves lives and gives you time to call the paramedics to get the person further help. Narcan is highly restricted in many countries, so some of the immigrants are unlikely to know much about it unless they've encountered it somewhere in the US already. We're hoping to take this model that we have with the 5 consulates that we currently work with and expand it to other consulates so that we can share public health education with other immigrant communities in LA County. Next slide. So before I wrap up, I just wanted to, invite all of you to our event in honor of National Public Health Week. It's going to be on April 8th, and we are partnering with our friends from the Mexican Consulate's Ventanilla de Salud to provide a space for people to meet and learn about health and benefits access, legal resources, and other wellness activities. The Mexican Consulate here in Westlake is their largest consulate in the world, and they are very dedicated to healthcare access for all, not just people of Mexican descent. So the Mexican consulate staff will assist people of any background with different resources, and all are welcome to this event, regardless of nationality. We'd love to see all of you there, and a flyer will be forthcoming, and we'll be sharing it with everyone as soon as it's available. So that's all I have. I thank you for the opportunity to share some of the things that we're doing in public health. I don't know, Heather, if there are any questions or.
Hi, Cristin. Sorry, I had to get back to the podium.
Sure,
Thank you
no
so much for
problem.
thank you so much for the presentation. Do you
Of
have any
course.
questions for Cristin about the programs that she's been describing? We were really excited to have Cristin join us today to talk a little bit about how public health is trying very hard to make sure that healthcare is accessible, approachable, and available to all, particularly in these uncertain times when it feels like there's a lot of fear in our community residents about going into public spaces. So we hope that what's been shared today is helping address some of those concerns and giving you confidence that our partners at the Department of Public Health are doing everything in their power to create those safe spaces and ensure continued unimpeded access to healthcare for all. Any questions for Cristin?
Heather, I see in the chat that Pam is asking for a flyer. We're developing the flyer, so we're gonna share it pretty soon. And when we can share the flyer with you, Heather, right? And you can disseminate it. In addition, in the next in person, we'll also share the hard copy of the flyer.
Fantastic. Thank you so much. And we did want to, of course, promote the fact that Public Health Week is coming up in April. There'll be a lot of events going on all over the city and the county related to Public Health Week, both here on the campus and throughout the community. So we'll be sure to be keeping you apprised of all of those events so you can participate in those that are nearest to you and that will benefit you most. All right. Well, thank you so much, Cristin, for joining us. It's wonderful to have you back. Cristin was one of the founding members of the Health Innovation Community Partnership. And so we're always delighted to have you come and join us, Cristin. Thank you again for your time today.
Thank you so much.
Oh, I'm sorry. I do see a raised hand from Jasmine. Jasmine, would you like to ask your question?
Yes, thank you so much. I just had a question. I know that when you don't have health insurance, you're likely to be asked to pay up front for medical procedures, and that's really a hard barrier for people. I'm wondering if there's program or any program has access to help relieve with that that cost.
Sure. There are programs that are, I know that, like I said, with immigrant communities, sometimes they're afraid to, apply for benefits, but medical has been expanded for other, for different things. For specific things, I think, we can reach back up to you for what specific needs you have. You can also call our public health info line, and we can provide the resources for you.
Thank you, Cristin. I get a thumbs up from Jasmine, so she got the answer she was hoping to hear. Thank you.
Thank you. Mm-hmm.
Anything else? Okay, with that, we will thank Cristin very much for her time, and we will move on to the next presentation. I think you're going to have to clear out of that so I can use the clicker. All right, there we go. All right, so next up, we'd like to share back with you some of the results of our recent series of community-based meetings. We're so excited to have been taking our messaging into the community. And with that, I invite Rosa Soto to come up and share a little bit about what we've been all about over the last couple months.
Heather, and stay close, please. So just wanted to appreciate everyone's efforts in making our town hall series successful. We were able to do what we set out to do, which was to ensure that our neighborhoods were elevated as in the importance of exchanging with our community in their spaces. Because so much development has been occurring during turbulent different times, right? One was COVID. The other is, some of the reality of this just 2025. It's been very difficult, I think, for community to be aware of all of the projects that are happening around them. So we wanted to make sure to go to safe spaces. We wanted to make sure to greet and connect with organizations that are part of those communities, really rooted, and have us together welcome the conversation. As you all know, Health Innovation Community Partnership is our opportunity since 2017 to sit at this equity table, to be able to exchange with each other what the needs of our community are and how the system responds. And to all of our department leaders who have been at the table over the series of years, thank you, because I know there's a lot of pressures that come with some of the projects that are being undertaken, and sometimes there's concern about how do we continue to keep the conversation going, don't overcommit, stay on budget, stay on task, stay on timeline. And every single project that has been presented here at HICP that has worked with our community effort and our community engagement has been completed successfully, on time, and on budget. So I am very proud to say to all of you, thank you, and let's continue this wonderful work. So we were able to hold 7 community update meetings in the last month and a half. We hosted it again in different neighborhoods, just delivered a series of presentations, and we're going to go over what those presentations were. And then if you missed them, we're actually going to see how we might be able to present some of those online. But as you know, part of this monthly meeting is to continue to go deep on the projects that are still underway and opportunities for engagement in the future. So the intersection will be not just what was presented, but also at these regular meetings, the opportunity for all of us to come together and continue to ask questions, uplift the importance of the topics to our community. The next slide, do I have the clicker slide? Okay, got it. All right. So what we covered was a vision for our healthy village, which, Chair Pro Tem Solis has been extraordinarily clear that our medical center is not only open to everyone, but that health is the focus of what we do. So we don't come to the hospital when we're sick. We come to the hospital when we're well too. And we expand services so that people can continue on their journey of health and wellness. And that is what, we heard from a lot of the speakers. The Health Innovation Community Partnership was presented, and all of the efforts that you all have done to ensure that we are equitable space, we are welcoming space, we are safe space, and we are space where dialogue can occur, and sometimes difficult dialogue, and we can come to consensus and find opportunity for advancement. We also had an update from LA General Medical Center and our leadership. You'll hear from Danny in just a little bit, who's our COO as well, about some of these projects underway. But Jorge Orozco, our CEO, Dr. Brad Spellberg, our CMO, and many of our leadership actually came to these meetings, and we're able to really ensure that it is clear to our neighborhoods. And we say it here again, that the hospital is open to anyone who needs to come for care, and that people shouldn't hesitate to come for care when they need it, as well as exploring all of the innovation and the world-class care that this medical center provides. Then we had a community conversation and feedback session, and a series of the project updates for all of the phases of the restorative care village. And so it was a heavy lift. And we want to, again, appreciate that it was many departments, many development partners who came to every single one of those HICPs. Every single one was represented. I know there are some slides that we might have to update a little bit just because we didn't have a lot of runway before this meeting, but I do want to just highlight, some of the pictures, some of the efforts. Some of our founding members were very instrumental in ensuring that people knew what their experience was like, and we also had them support us in collecting comments and giving feedback. So, it's been an extraordinary opportunity. Again, Lincoln Heights and Sereno, we had 2 here at LA General Medical Center for the employees and partners here of our medical center. We then, went out to Costello Park in East LA, Chinatown, and then City Terrace. So we were able to, Boyle Heights, Chinatown, and the City Terrace, East LA. So we were able to really enjoy some of the food from the local neighborhoods. Each neighborhood, we showcased a restaurant from that neighborhood, and we were able to just have extraordinary conversation. And again, it's not an easy time right now for people to come out, and so we just want to say thank you, thank you, thank you. Some of the themes that we heard from our audience, and again, a lot of the folks, that were in the audience, you might see some, you might think maybe some lower numbers, but remember, this is a time when people are having a difficult time coming out, for different meetings. So we actually were proud of the numbers that we're seeing, because we know it isn't just about the person who comes, but it's about the information that they can take back and who they can connect with in their neighborhood and in their community. So questions about our future plans on West Campus, concerns about parking and transportation, concerns about safety on the campus and the corridors, mental health and substance use services and how to access them, questions about affordability and opportunity for housing, services for the unhoused, priority of the local residents to access housing and other services. So again, I think in some neighborhoods there was an emphasis more than others, but in general, I think all of the town halls had this variety of themes that people were concerned about. And here are some quotes that we wanted to highlight because, again, we're just ever moved by, the opportunity that we have to listen to our community. I live in Chinatown. I want to have full hospital service nearby for the local community people to go, especially an ER. This is a large mixed project. What percentage is the affordable section of the building? What is the rent on affordable units? Thank you for this great project supporting the community, adults and youth, focusing on mental issues and addictions where the community really needs that support. And then, will there be a unit focused on individuals who have attempted to commit suicide and need intense inpatient programs? Will you have support groups for caregivers and families impacted by having a family member with a mental health crisis or illness? What I see in this is that there's a lot of concern in our community, and there's an opportunity that we have to continue to make those connections. So if, in some of those meetings we fell short on time, we're going to continue to dig into what were those questions, how can we then, via the vehicle of HICP through these meetings and others, continue to answer those questions and to connect people to service. Okay, remember, this is a space where you can come and actually get to know the people that are sitting across your table. And that goes a long way at a time when people want to ensure that access to services continue. And it also helps deter a lot of the fears and concerns that sometimes keep our communities paralyzed. So, I want to, again, thank the presenters and panelists. We took a little picture for those that were left at the end of our very last session, and just appreciating each and every one of you for the time that you spent with us, with our community, the time away from home, and the longer hours of work. Again, thank you to all the departments.
Yeah, thank you, Rosa. Yeah, does anyone have a comment or a question about the series of HICP community update meetings?
the online.
Oh, I see a hand raised from Alejandro.
Bueno, la importancia de estos meetings de HICP, la
The
verdad que
importance of
fue un
these
reto,
meetings, HICP
nosotros
meetings,
haciendo
it
la
was a
casi como que en las
challenge.
calles,
You know,
la
we're
gente
doing
tenía
outreach
temor,
on the
pero la gente
streets. People
necesita
were
esta comunicación.
scared, but people
Y
need this
gracias a que el
communication.
pueblo, la
And
gente,
thanks to
con su
our
necesidad de
people,
comunicarse
you
y
know,
nosotros de comunicarles,
so with the
hicimos un
need to
enlace y gracias a
communicate,
eso
and we
se
you
procedió
know,
que estos
closed
meetings
that
tuvieran
breach,
ese alcance con la comunidad.
region,
Creo que hablé
we were
mucho,
able
pero
to
en verdad fue
communicate
un
with
reto
the
que
community.
se
But
pudo
honestly,
lograr
it
que la
was a
gente tuviera esta
challenge, but
comunicación.
we were able to
Gracias.
accomplish this communication between our people.
Challenging, because people fear, we were able to link information with the community. So like I said, even though it was a challenge, we were able to distribute all the information. Thank you, don Alejandro. Muchísimas gracias por todo su esfuerzo y corazón.
Thank
We
you for all
appreciate,
your effort and your heart.
just all of the efforts and the heart that our leaders in our promotora and CHW program, community health worker program, put into ensuring that we did the proper outreach into community. We did hear at one of the meetings that people, want us to visit them, that sometimes the social media only goes so far, sometimes the emailing only goes so far, or texting, and they have actually appreciated seeing you in the community and they want to see more of us. So we're going to connect with our HICP partners and see how we can continue to disseminate information out into the neighborhoods in a very intentional, sort of close to home way.
I think we have a hand raised from Pam in the chat.
Hi, Pam.
You can ask your question.
Hi, Rosa. Well, first of all, congratulations on 7 meetings. I really just want to give props to everybody, the different weather conditions, last minute, sometimes, like things that needed to happen, your team, Rosa, and everybody was just always very positive. So as a member of HICP, I enjoyed attending these meetings. I heard a lot of feedback and I agree with the categories that you have shared with us today. Particularly, safety was one. I think jobs. In the 2 meetings that I attended, I also heard about questions about job opportunities that folks wanted to be more plugged in. And I just want to encourage HICP, like from our members that those of us at Eastside Leads that we participated, I think there was a strong desire to go a step beyond 2. Like part 2 of all of this engagement is how do we get to those concerns addressed, or how do we get those clear answers of affordability and housing and services. And I think it sparked that, right, interest in a broader community. And I think I look forward to tackling those categories that you listed, Rosa. And then secondly, I guess I wonder if folks that signed up or folks that signed up in person, will they be invited to HICP? Or I encourage them or encourage the team to invite those folks into this monthly space. So comment, and then that's my last question. How can we replug those folks that came and signed up, and maybe they can join us here? Thank you, Rosa.
Thanks so much, Pam, and thank you as well to all of the partners in Eastside Leads who ensured that we had the word out there and people came to several meetings. So just really appreciating your continued partnership and leadership. Yes, we want to ensure that we are looping in everyone who we collected information from. We wanted to be very limited in terms of taking information on site, just to protect people's privacy. But there is a way that we, if they signed up online, or we were able to sign them up online at the door, that we will have their information and log them in. We did have at each meeting a number of people that just didn't want to sign in, and we're okay with that. But hopefully word of mouth and the way that we can continue to connect through our partner organizations and our programs, we'll be able to continue to let people know of the services that are available. And you mentioned jobs, and I'm sorry I wasn't on the list. Again, we still have some work to do. This was a highlight. We're going to put together a comprehensive report. We want feedback from our partners, right? We want feedback from our supervisor and her team, our chair pro tem. And it's important that we continue to just be responsive, right? And yes, so we'll get that report, on a timeline, and then hopefully a month we'll have it ready.
And a question from the audience from Mondy.
Buenos días a todos. Gracias por la
Good
oportunidad.
morning. Thank you for the opportunity. I want to say that I feel very proud to be part of the team of these meetings that were successful for me. The best decision was go to the communities. I think a lot of people can have access to this, and I think it was the best decision.
Good morning, all. Thanks for having me here. And I wanted to let you know that I feel so proud that they were very successful. Due to a lot of people not being able to drive all the way here, we were there and we were funding. Thank you.
Absolutely. Thank you so much, Edith.
And I have an additional soy participante del equipo de autos de las calles en la comunidad.
I'm one of the participants, the teams reaching people out on the streets, and there was a lot of participation. I'm sorry, but I'm having a hard time here.
Muchas personas no fueron, pero ya saben esta información que se está compartiendo en los grupos. So good morning. I am one of the participants for the outreach team. And I will say that maybe a lot of people didn't attend the town halls due to weather or other restraints. But the most important thing is that they have a flyer with the information in their hands on what we're doing, and so that way they can share it and they can know what we're doing. Thank you so much, Nancy. I think that might be everything, unless there's anything online.
Nothing online. So again, just hold out for the report. It'll be back in about a month. And I just want to say one final thank you to Chair Pro Tem Solis and her team. They were in full force at every single one of the meetings. I know there's a lot on the plate. I did, people asked, where was supervisor, but she was been everywhere. There's been so much going on. And so I really felt like her presence was felt. It was connected. And again, just appreciating her leadership to ensuring that this Healthy Village vision is coming to life and that people are responding in a way of better understanding and, and contributing those needs on a continued basis. So thank you to Chair Pro Tem. If you can take that back to her Guadalupe and team, we appreciate it.
So with that, it is now time for our 5-minute networking break. So we'll let everyone take a quick breather. For our interpreters, you guys can take a breath as well. Please help yourself. If you're here with us in person, please help yourself to some coffee, to some breakfast treats in the back. And we'll be restarting in, I'd say, 4 minutes at 9:55. We'll see you then. Okay, I think we're ready to get started with the next presentation. We're spending the rest of our time together today talking about campus accessibility. And we have a series of incredible speakers who are here to talk about the multiple aspects of how do we improve access both to the campus and then around the campus. And we want to respond to your questions and concerns about making sure that we take into account all of the needs that you see in terms of how you are able and the people you know are able to use transportation to get to the campus, whether it be private, public, or other. We just want to make sure that you know from us who are doing all the things that are in play to make the campus more accessible, and also to hear from you your questions and concerns. So please get those questions ready. But we'll go ahead and kick things off with our first speaker, Erik Munoz from the Los Angeles Department of Transportation. Erik, would you prefer to share your own screen or would you like us to advance the slides for you?
I would prefer to share my own screen.
Okay, then we will stop. Oops. We'll stop sharing and allow you to do so.
Sounds good. Can everyone see my screen okay?
We can. Thank you, Erik. And welcome to Erik Munoz from the Department of Transportation.
Hi, great. Thank you for having me. My name is Erik Munoz. I'm actually with the City of Los Angeles Bureau of Engineering. And I'm the project manager for the Valley Boulevard Multimodal Transportation Improvement Project. Because for the sake of time, I'm going to focus mainly on the area around the campus, but I will give you a project overview on what we've been working on. So the Valley Boulevard project is part of a series of 3 other projects in the area that will improve the mobility around the area. So we have the Valley Boulevard project, which is in blue. We have the Eastern Avenue project, which I'm also the project manager for, which is in purple. And then we have the Huntington Drive project, which is in orange at the top. So focusing more on this project itself, the Valley Boulevard project, will start at LA Union Station and up Mission Road, and then you can see where the campus is located, and then through Valley Boulevard, and then all the way up to the 710 terminus. So just a quick summary of the goals. We want to improve mobility and accessibility in an equitable manner. We want to connect communities, education, healthcare, and transit centers. And then we also want to provide green space and enhance mobility options to create healthier community. And that's all going to be part of the near-term improvements. We also have some long-term improvements for the project, which is to improve safety around the rail corridor. I'm going to move on to the community engagement that we've had so far and what we've learned. So we have had a robust community engagement. You know, we've had multiple community outreach meetings. We've had press releases, email notices, social media advertisement, texts, Bureau of Engineering and Council District 14 websites, and then word of mouth. And then later on at the end, I can show you what the website for the project is and how you can sign up to receive notifications and project updates. So we have had 2 in-person meetings and we've had 2 virtual meetings. In these meetings, we presented the project alternatives, and the community had a chance to vote on which alternative they liked and preferred. And 91% of the community voted in favor of alternative 3. So in the next few slides, I'll be showing you what alternative 3 is and how it'll affect the area around the campus. So as you may know, we do have some degraded roadway. We have lack of connectivity for bicycles and pedestrians in the area. There's lack of insufficient pedestrian lighting and so forth. So we definitely need to improve this corridor here. Let me show you what the improvements will look like. So because we have such a long segment, we're breaking it down into segments 1, 2, and 3. The area around the campus is between segments 1 and 2, mainly segment 1. Here, instead of showing you verbiage, I'll show you pictures. Pictures always work best. So we have segment 1 on Mission Road, and this is what a typical cross-section will look like. These are the proposed features we have. So we have proposed sidewalk, a 2-way cycle track. We have some green space. We're proposing bus-only peak period lanes and a raised median. So this is just a typical cross-section. And then this is an example of what this is zonal emission. This is what it looks like now. And this is what it would look like with the proposed changes to improve the mobility for pedestrians and for cyclists and for everyone who uses the public transportation system. All right. This is also segment 1, which is Mission Road. It's existing. And then I'll switch to what the proposed system would be. And as you can see, it would have sidewalks, the two-way cycle track, the peak period bus lanes, and so forth. This is the intersection of Mission and Valley. So as you can see, Lincoln Park has always been divided here in the middle and Parque de Mexico. So I'm going to show you the proposed Lincoln Park expansion, which would have the cycle track running through it, and it would make it more pedestrian and cycle friendly. And then I'll show you one more. This is around Main and Mission, and this is what it would look like with the cycle track running through it, and then having the park expansion completed. Then we have segment 1, Valley Boulevard at Lincoln Park, and this is a rendering of what the multimodal improvements would look like. Now we do have, we do have segment 2 and 3, but because I would like to, and it's very similar. Segment 2 is very similar to segment 1, with the cycle track, with the sidewalk, and so forth. So I'm going to go ahead and skip that for the sake of time, because I would like to answer questions. And let's see. So the next steps. So we are going to have one community meeting each year, since we are going to be in design for 2 years. So if you are interested in joining one of those community meetings, the announcements will be posted on this website here. It's 710mobilityla.org. And you have the option to sign up for alerts for either all 3 projects or just one of the projects. And or you can log into the Council District 14 website, and you should be able to see project announcements there. So be out on the lookout for those community meetings coming up for Valley Boulevard, 1 a year. And if you would like to jot this down here, the 710mobilityla.org website. Oh, and then just one more thing I wanted to state is we're anticipating construction around August of 2027. And with that being said, I'm open to answering any questions.
Thank you, Erik. Do you have any questions for Erik? The incredible improvements that are planned for Valley Boulevard. It looks absolutely beautiful, I have to say. We're very excited. Any questions? Oh, good. And Severin is on the line as well and happy to support.
Muy buenos días a todos. Toda esta
Good morning,
información,
everybody.
Oh,
This information that we received, this is the second time that I'm here. We're lacking communication about this information at events in Water Center. Somebody called me and I told my colleague it's a very nice time to come here to this type of events because there are parents that can be there. This room is so huge and we're very little people. This room should be full of people. There's no communication. We're not notified about these events. Now, going back to the transportation.
cerquitas de aquí, pero sí soy
I
del
don't
este
live
de Los
nearby,
Ángeles.
but I
Nos
from
quitaron una
West
ruta.
LA, and we
Yo
don't
recuerdo
have.
el año que nos la quitaron, Ruta 30.
I think it was Route 30 that we
Pasaba por
were not allowed to use
Flora
anymore. We don't have it now.
hacia
From La Flora to
colegio y del colegio hacia el centro de
the
Los
campus
Ángeles.
to downtown
Era
LA.
una buena transportación
It
porque
was a
no nada
very
más yo
nice
soy una
transportation
persona que no manejo. Hay
because
personas más
I'm not the
mayores
only
que
one
yo
that
que
doesn't
no
drive a
pueden
car. There
caminar
there are
largo
many
tramo
people out there
y esa
that are
era
not
una
able to
ruta muy buena
walk
para las
for long
personas que no
distances.
manejamos.
And it was very
Se
nice
hizo
for people who
mucho
don't drive.
juntas
We had
en el centro
meetings
cívico del este de
on
Los
the
Ángeles. No entiendo por qué no
hall,
nos volvieron a
downtown
poner
halls,
esa ruta.
and we
Para mí, para
don't
varias
have this
personas que no
route
están
anymore
aquí,
for
pero
us
yo
and many
soy la
other
voz
people
para
out there,
ellos
and
y
I'm
comunicar que
talking on their
pueden
behalf,
venir para que escuchen su voz.
and they can be here
No
so
se
they
logró
can be
o no se ha
heard
logrado
by you.
que nos vuelvan a poner esa ruta
We want this
para
route
poder
route
asistir a
back
diferentes lugares, incluso a
because we
este
need to go
lugar.
to different
Sería
places.
nada más usar eso, así
Also,
uno más.
this
Y
this
ahora
one
ya
that you
es
mentioned,
más tiempo.
because it's a longer time to get there.
Perdón.
No, I'm sorry.
Eso es lo que yo estoy viendo por mí misma y por los de
This is what I'm
comunidad para poderlos
noticing
notificar.
myself,
Espero buenas noticias
and
en el futuro.
I'm hoping good
Gracias.
news from you in the near future. Thank you.
Sorry, I had to cut it because her comment was going a little bit lengthy for the interpreter. She says that she has come to the meeting. This is her second time that she comes here to the event. And she's a little bit frustrated because of the lack of communication for these types of meetings, not just for her, but to the community. She got a call from the wellness center about this meeting, and that is how she let her friend know that's sitting next to her about this meeting. This room, as you can see, is pretty big, it's pretty spacious, there's a lot of empty chairs. And this is a good time, for parents to come after they've done it in the morning. But for some reason or another, it is not full, and it should be full because all this information is valuable to the community, to them. Their input should also matter, but they're not here. In terms of the transportation, a couple of years ago, Route 30, the bus line, Route 30 was removed. It used to go from Flora Avenue to the college to downtown. But for some reason, it was removed. She doesn't drive, and people that are also older in age that can't walk for a long distance has affected them in this way. She's been to too many meetings in regards to, giving a presentation about transportation, but the route is still hasn't been given back to the community. And she's glad that she's here. She's the voice for all of those that she can't come. But that's just her main concern. What about this route and to make it more accessible for others to come to the meetings and to, get around the city?
Yes, thank you so much for those very, very important points. I think Rosa's going to address perhaps some of that.
Muchísimas gracias por estar aquí. Thank you so much for coming and for raising your thoughts. And I'm so glad you got a call about this meeting and that you're inviting people, because that is one of the main ways that we are ensuring that our word gets out, right? Is making sure that we contact those of you that are interested and asking you to call others that can come. And we will continue to look at ways of making our meeting more accessible. This meeting in particular is one where we are it's meant to be the discussion point for some of the points that we're bringing, and the time worked for both our county partners, our nonprofit partners, and our community leaders that decided the time at when it was set. But we can relook at that time, absolutely, if it's a different reality. And you said it's a good time, but we can relook at that time. We can relook at ways that we are outreaching. I can say for those of you that, so there are a number of our CHWs and promotoras in the room. They work very hard. They go to more than 30 sites, around our community, schools, churches, businesses, laundromats, community centers. They go to, different events that are happening in the community to talk about our services. And then they flyer door to door. So there's a lot of intention, right, in what we're doing to make sure that everybody knows about our meeting and using our resources to truly access. But we understand it is a tough time, and we understand the information is valuable. So we'll continue to work with you and with others. If there are places you want me to make sure that we include in our outreach, we are happy to. The extra of calling our we have a listserv at the Wellness Center of over 44,000. So we are calling people in certain zip codes for those community meetings as well. So thank you for answering the phone. Because I know sometimes it's also hard when you're getting a lot of calls. And so, anyway, just wanted to make sure that we're all feeling, really good about what we're doing together and continuing to expand people's understanding of our opportunities here. We also record every meeting. So if there's ways that we can pull sections of the meeting to be able to highlight at other community meetings, right? We're happy to go and talk about our work together. Thank you. Oh, and Guadalupe has a comment.
Again, thank you for your comment. And I know we're going to have other speakers on the transportation, different types of transportation modes. So in regards to the Route 30 that you mentioned, maybe that's something we can see, and look into. But we'll have other speakers, including from our Metro bus lines. And but please continue to join us. All right, and it looks like Erik has a slide up that Erik might like to present.
No, I just wanted to make a comment that the project will include peak period bus only lanes, which will improve the the bus transit time. That was the only thing I wanted to mention regarding the Valley Boulevard project in regards to the caller's question.
Perfect. Thank you for highlighting that. And as Guadalupe mentioned, we have additional speakers here today on the Metro bus lines. At next meeting in April, we'll have someone from the Dash bus system coming and speaking. And the Metrolinks, sorry. The Dash is today, right? Dash and Metro bus lines are today. Pardon me, Metrolink is next week. So hopefully we'll be able to get to that specific question you have. And as for your more general question about helping fill this room so that we get as many people hearing this wonderful information as possible. Thank you so much. You inspire us by coming yourself out, bringing your friend and neighbor to come with you. We take that very much to heart, and we're so appreciative because all of this we do is really to reach people in the community with this information and hear from you. So thank you so much, and we will make sure that we redouble our efforts to reach people out by phone and by flyers and by our incredible outreach team in the community.
Century Housing. We have the Century Housing development at Mission and Zonal. And so, again, the visuals were great, Erik. Thank you for providing them. They really speak to a lot of detail, a lot of improvements that will be included as part of the concept. And we do look forward to ensuring we share out when you have, your next meeting on the design. But we'll be happy to also see how we can coordinate efforts with the Century Housing project there that will also have like a mobility hub as well. So thank you again for joining us, and hope you could stay on for the other presentations. We would love to just have a whole coordination effort. I know we have some of our Public Works County staff here joining. And we'll be all listening in.
Thank you so much for the comment, Guadalupe. All right, so we're going to continue the conversation on transportation. Why don't we continue on with our presentation, and we'll continue to take questions throughout. As mentioned, we have 5 experts here to speak with us about campus accessibility and transportation. So we want to get through all of our presentations. Next, we're delighted to have Wayne join us from LA Metro. Wayne, would you care to share your own slides, or would you like us to share slides for you?
Oh, no, you guys can share the slides.
Okay, sounds great. Pull those right up and get started here.
Oh, almost. There we go. First of all, can everybody hear me?
Yeah, you sound great, Wayne. Thank you.
Great. If you look, I don't know who can see my picture and name, but I was sent a link this morning, and it has me under Jasmine Garcia Delgadillo. But anyway, my name is Wayne Wassell. I'm the Director of Service Planet at LA Metro. And I'm just really basically going to introduce all the lines that we serve, our bus lines that serve the Los Angeles General Medical Center. And we're really excited about the projects that Erik presented. And I really encourage everybody to go to that website to check it out, because that's going to facilitate our services on Valley and on Huntington Drive and Mission. In fact, I've worked with their consultants on that project on Huntington very closely. We can go to the next slide. So Metro operates 8 bus lines that serve the hospital campus. One serves directly in through Zono and up, and it serves the outpatient clinic near San Pablo and Zono. We have 4 that serve on adjacent streets, the 76, which is on Valley, the 78, which operates on Huntington Drive through Mission Road. And then we have the 106 that operates along Marengo. We have the 251 that operates along Marengo, and 605 also operates on Marengo. Then we have 3 bus lines that operate in the I-10 freeway busway, and that is line 487, line 49, which is only weekday peak, and then there's the J line that operates from Mondy Station through downtown LA and then gets on the 110 express lanes and operates to the Harbor Gateway Trans Center, and eventually the 9, one of the routes operate all the way to San Pedro. And I'm going to give you a map here that gives you an idea of what I'm talking about. Let's go ahead, next slide. So this is the map. The green line represents the busway. So there's the 3 lines that operate, the J line 47. You can see where Valley is, and I outlined the 605 where the outpatient is. And you can see how our lines operate through to serve this hospital. So basically, this is just a short presentation and introducing everybody to what services we operate to serve the hospital. Now, just I wasn't really prepared. I wasn't asked to, but there are ways that we want to improve services. I want to take the 76 into the hospital campus. I can't do it through San Pablo because the freight train there is unpredictable. And you can't bring it up an access road to Soto because the bus can't make that tight turning movement. Otherwise, I would have taken the 76 in. I worked with some folks on that. The 605 is another one. There's going to be some issues. Right now, we operate 32-foot buses into the outpatient clinic, but it's a very small parking lot. And we're soon to convert our whole entire fleet to 40-foot buses. So we would like to still continue to serve the outpatient clinic directly, but that's where we terminate service and that's where we lay over. Right now, they're using 32-foot buses, and we're going to go to 40-foot buses. So I did a test trip the other day, and it's going to be an issue. So we're going to have to work with the city of LA that owns that parking lot to see what we can do to redesign it to accommodate the 40-foot buses. I also want to reroute the 605. I want to take it down Soto, go down Norfolk, and eventually that turns into East 8, west of San Pablo, and then it makes a left on Biggie. The problem there is there's this gut truck that's sitting at the red, and it makes it very difficult for the bus to make a left turn there. Also, there are no stop signs in both directions, east and west on Zonal that allows the bus, that facilitates the bus to be able to make a left turn safely there on Zonal. This will allow us to serve also the Keck Hospital of USC that you see in the upper right. And so we're pretty excited, but we got some work to do. We do want to improve our services to serve the hospital directly. And that's basically my presentation right now. So I'll take any questions.
Thank you so much, Wayne. Sounds like this is a challenging environment to try to bring those buses in, particularly as the bus length is growing. So do we have any questions for Wayne?
Thank you, Wayne, for joining us today. This is Guadalupe with SC1. I think one of the things that we have also been hearing is, as you know, this is a county regional significant site. And so we're trying to see what are some of the ways that we can improve and reduce the number of transfers, right? I think one of our speakers here earlier mentioned there was a bus line 30. I don't know if it was a metro line or a dash line. I'm not sure, but I figure it's a metro bus line from East LA that was removed. But in general, I think we're trying to see from the different surrounding communities, such as Iseles, El Monte, Boyle Heights, Lincoln Heights, Chinatown. We've been asked to see what are some of the ways we can improve the bus system, like to reduce the number of transfers to get to the medical campus. And maybe that's something we can work on together as part of the enhancements for access. We'll be happy, to explore that. I don't know if you have any thoughts around that.
I heard you mention line 30. Now, line 30 used to operate through Boyle Heights into East LA, but it never touched the hospital. Now, the one thing I did with the 106 during Next Gen is I extended the 106. It was a short little shuttle that only went to Boyle Heights and didn't go to East LA. That shuttle now, the 106 actually operates through East LA, through Boyle Heights along First Street, and will go all the way and into, it serves Little Tokyo, but it will also serve the Union Station. Then it comes up and it does what the old 71 used to do, going up Mission Road, and then we'll go down Marengo. So you have direct service there to the hospital on line 106. Then you also have the 605 that's going up Soto northbound that will go down Marengo, and that does serve 605 also. So those don't require any type of transfers, as well as the 78 and 76.
Thank you. I definitely will connect with you and see, what are some of the ways from the different communities we could take a wider look. But thank you so much.
You're welcome.
Thank you so much, Wayne. And next we have a presentation by Sasaki of the Los Angeles Department of Transportation. Would you care to share your own slides, or would you like us to advance the slides for you?
If you could present the slides, that would be wonderful.
Perfect. Happy to.
Apologies. I had one question or suggestion for the previous slide, please.
Come on, Jasmine. Please ask your question and then we'll pivot to Kay.
Thank you. Yeah, I think for me, what's missing is an expansion, like on Soto past Marengo towards Valley. I know access for Ramona Gardens to the hospital would be a lot easier if that existed. I know I have had my own struggles trying to get from Ascot Hills to the hospital area.
Yeah, we used to have line 252 that used to go out that way. The issue there in that segment that you're talking about was, we had to make some tough choices when we did Next Gen, which we redesigned the whole entire system. The board we were operating 7 million annual revenue service hours, and they directed us to improve a system and to increase frequencies on more lines all day long, more nighttime service and on weekends, with only 7 million revenue service hours. So we're right there again, operating at that level. On that segment, unfortunately, there was like maybe 8 to 12 people a day that were riding there was just very, very low, so unproductive that was one of the segments that got slashed. And I don't know if doesn't Dash serve around there or some type of service, I think, that can get
Yes.
you to, yeah,
It
to like,
is. Yeah, it's also pretty inconsistent, and it also doesn't reach all the way to Marengo. It stops right where USC Keck Hospital starts.
right, yeah. So you can get in there and then you'll have to it'll be a little bit of walk unless I don't know how the shuttles work within the hospital campus, if it's just for employees. I know there's an LA County shuttle in there and there's the USC shuttle. So are those available to the public? I'm not sure.
Well, we're going to have a presentation from Los Angeles General Medical Center talking about the General Medical Center shuttles. I don't know the USC shuttle system.
Okay. Yeah, we'll see what we can do in the future, but I do look forward to any type of meetings with the community to see how we could facilitate the movements of our bus system, making it whatever changes we want to make. I know right now I want to make changes to the 605, but I'm having a difficult time with the city. Work with some engineers, and then all of a sudden there was zero communication. So I'll try to start that up again.
Thank you so much, Wayne. We appreciate your response, and we appreciate the opportunity for ongoing conversation as these systems do continue to evolve. All right. So, and thank you for staying with us for if there's additional questions at the end that might pertain to all of the transportation information we're sharing today. Next up, we have Sasaki from Los Angeles Department of Transportation to talk about Dash travel opportunities.
All right. Good morning, everybody. My name is Sasaki. I'm a transportation planner here at LADOT, and we operate the Dash Community Circulator. And I wanted to give you a quick overview of what we're about and how we connect to the hospital. Next slide, please. Okay, so Dash buses operate in 27 neighborhoods plus downtown LA. And it's a service operated by the city of Los Angeles. So I know many folks get us confused with Metro, but we're a little different. And then the purpose of our Dash routes is to circulate within the neighborhood and connect local residents within key destinations of that neighborhood that we serve. So we connect to a lot of grocery stores, schools, people who need to get to work, hospitals, and we also connect to other regional transports like Metro Rail and other Metro bus routes. Slide, please. And just to give you a visual of what we look like. So on the left here is our Dash El Sereno bus stop. So if you see a sign like this, you know that we serve there. And then we have two bus designs in our fleet at the moment. So we have the blue Dash bus at the top, and then our newer buses, which is all electric, is the one with the green stripes. So they're both part of the LADOT Dash network. Next slide, please. So we have 3 bus routes that serve the medical campus. So first one is Lincoln Heights, Chinatown. And we also have Dash El Sereno City Terrace. And another one I forgot to mention is Boyle Heights also serves the medical campus as well. And our buses run pretty frequently on the weekdays, somewhere between 10 to 15 minutes on the weekdays. I think Lincoln Heights headways might be a little longer, but we generally like to come pretty often. And all of our routes connect to the Metro Rail routes. So, we serve as the first last mile service to the neighborhood. So, like the red line or B, the purple line, the gold line, L, and also other Metro buses as well. So we work as a good connector to a lot of the other transit networks that we have in Los Angeles. Next slide, please. So this is a map of our DASH network. You see in the middle of the map is the medical center. The brown route that gets to the medical center versus the Lincoln Heights Chinatown route. It gets you across the bridge on, I think, First Street, connects to Union Station. So any routes, trains that gets to Union Station, you can use the Lincoln Heights Chinatown route to get to this campus. And then the next one is the orange one that goes south of the medical center. Let's see, this one goes through Boyle Heights, gets into East LA, and then it connects to the L line, the gold line. So there's another transfer opportunity there. And then Dash El Sereno is the one in purple. It doesn't get directly into the campus, but it does get close to the USC portion of the hospital. Then that's the one in purple. Also has a transfer opportunity on the L line on the southern part of this route. And then I forgot to mention the Lincoln Heights Chinatown portion also connects to our downtown network, which is pretty extensive as well. And so those are the routes in alphabet. So like A line, B route, we have E and F. So if you these all connect to Union Station and the downtown areas. And so if you get into downtown, there's it's pretty convenient to get to Union Station and then onto the medical center. Next slide, please. So I wanted to talk about accessibility. So all of our buses have low floors and ramps, so it can reduce the bus height and get to the curb level, so that there isn't a big step for residents or riders who want to get on, and it makes it easier to get on and off. And then all of our buses have ramps, so people with wheelchairs or strollers can easily get on and off as well. And then inside our bus, there's priority seating where these buses or these seats fold up, so a wheelchair can be securely strapped onto the bus. And then we also have audio visual support inside the bus, so riders can see. There's screens inside the bus where riders can see like what the next stop is, and then also makes audio announcements of what the next stop is as well. Next slide, please. So a little bit about our fares. If you just get on our bus and pay a cash fare, it's 50 cents. If you have a tap card, it's 35 cents. And then we have many discount fare options as well. So senior disabled folks on Medicare can get on the bus for 25 cents cash or 15 cents on tap card. And then if you participate and are eligible for many of these free programs, for example, if you're a student or if you also participate in our City Ride program, that's our paratransit service, any of these Metro or MetroLink fare options, Dash also comes free with those as well. Next slide, please. And just to kind of speak about the experience of riding one of our buses, we clean our buses every day. A lot of the new buses, we switched out our seats to have those padded vinyl seats. You can kind of see in this picture, so it's easier to wipe down, and it's not those cloth seats anymore. We have cameras within our buses that kind of monitor what's going on, and also our drivers are trained to de-escalate any sort of situations, incidents that might happen, and are trained to kind of deal with any sort of security issues as well. And then we wanted to make sure that our buses are always well lit. and come with accessibility features as well, like the audiovisual announcements that we talked about earlier. Next slide, please. So we have a lot more information on our website at ladottransit.com. So if you want to look at detailed maps or schedules or access our live bus location feature, all of that can be done on our website. We have the contact info for our customer service line or the transit store for in-person customer support as well. And then again, my name is Sasaki. I'm a transportation planner here at LADOT. And if you have any comments or questions or anything like that, you can always reach me at the email you see here. So I'll stop here if anyone has any questions.
Great. Thank you so much, Kay. Any questions for, oh, we do have a question in the back.
Oh, sorry. I have a question that do you cooperate with the Department of it's a Los Angeles County Engine Disability Department transportation? It's like a city ride card, but it's just you cooperate with the city, no, with the county. I'm sorry.
Is it so? The question is if we work with the county of Los Angeles?
Yeah, it's a Los Angeles County Engine and Disability Department.
I'm not sure, to be honest. Whenever we make any sort of service changes, we do reach out to all the public agencies and a lot of the community organizations such as this one. And then I know our city ride service, I think probably is in touch with a lot of these the cities like disability and county's disability service. And we work with Access as well. So we're kind of a parallel service, a complementary service to those options.
Absolutely. Hey, Kate, this is.
I know that you're a city, but the county, they have their own department. It's called Engine and Disability Department. I don't know if you guys cooperate together.
Yeah, we do. My name's Hsing. I'm one of the transportation planning at LA County Public Works. We do coordinate with Dash, for example, the Boyle Heights line. We actually pay for half the Boyle Heights line for Dash. So we do have a transit section that works with the city of LA on various. We try to coordinate the two. Now it's a bit tricky because the surrounding area jurisdiction is the city of LA. But we do work with, like, for example, MetroLink. We work with Metro. We work with City of LA and different entities, HICP, to try to improve transportation to the line. Does that answer your question? But we do, for example, we do pay for half of the Boyle Heights line for Dash.
They contacted me, the county. They contacted me that they're different from this city.
It is. I mean, the Dash is run by the city of LA.
Yes, but they told me they have their own Department of Transportation, the county.
We have a transit section. We do have different county local lines, but the one, because around the LA General Hospital is the city jurisdiction, it's run by City of LA or it's by Metro with the Metro buses. Yeah, but I'd be happy to talk to you afterwards more about any specifics as well. Okay. I'll stick around as well.
It's done differently by to the city. They do their own transportation, like a city ride thing. But in terms of the Los Angeles County Engine and Disability, they have their own transportation department.
Yes, I mean it's we have our own transportation like transit, but we do work with the city. But yes, the Dash is run by the city of LA, but we do coordinate with Dash, like such as we paid for half of the Boyle Heights line, which goes to the southern portion of LA General Hospital, and I think it loops up to like Zone or so. But so that is correct.
Thank you.
Yes.
This transportation types, like between the county and the city, like how do they coordinate with those kinds of transportation, avenues, given that they serve more like the disabled or seniors, so how is that coordinated?
I mean, we have our own trans section, but like if it's the Dash line, it's really run by the city. But if we have any input to try to help input, that we do talk to them. But the actual route would be selected by the city. I would but we, if we're looking for more details, I could definitely put you in contact with our transit section head as well. I'll stick around after the meeting as well. Great, thank you.
Great. Thank you, Hank. We really appreciate it. Well, our final speaker who has stuck it out with us from the very beginning of this meeting, I'm so delighted to bring our CEO of LA General to talk with us about the shuttles that are hosted here on the campus. And we have a comment in the chat about the USC shuttles as well, but I'll let Danny start.
Good morning. My name is Daniel Amaya, and I'm the Interim Chief Operations Officer. So I'm just going to describe very briefly to you the shuttle services that we operate on campus, which seem tiny compared to what you just heard in terms of the city. But we have shuttles that operate between the hospital and the train station for purposes of our staff, but also for visitors. It's available to both. The shuttles from the train station, Union Station, to the hospital operate about every 17 minutes, starting at 5:40 a.m. and the last one at 8 a.m. And then in the evening, for folks going back home, they operate about every 35, 38 minutes from the bottom of General Hospital or Lot 5, which is right across from the clinic tower, to Union Station. And these operate about every 38 minutes, as I had said. So this is a service we provide to help facilitate the transportation of patients and visitors. Now, within the hospital, the medical center, because it is such a huge campus with many hills and uneven streets and sidewalks. I don't know how many times I've tripped to those, but we have a shuttle, two shuttles that cross over that cover essentially all the main entry points to our clinics, starting with parking lot 10, which is off of Mission between Zonal and Workman, where the Jack in the Box is. Traveling then north to Building C, which was the old Rand Schrader building, covering the outpatient building, the OPD. Then to the base of General Hospital, which is where our patient financial services is, and then ending, culminating at the entrance of the clinic tower. There are no set time frames for these shuttles. They run around every 25 minutes. The reasons there's no set times is depending on the amount of help or support the patients and or visitors or staff may need, getting in and out of the shuttle. That may take some extra time, but in general, they run around every 25 minutes. One of the stops here that's lacking that I definitely want to look into is there's currently no connection to the parking lot 9 by where the Metro bus station is. And while it's not far for people to walk, certainly when it gets dark early or at night, it's not always the safest feeling walk for people to make. So we want to see if we can improve the shuttle service from that area. So that's essentially the service that we provide on campus as far as transportation. I'm happy to answer any questions anyone may have.
Buenos días nuevamente. Me gustaría saber.
Morning. I'd like to know there are some spaces where they were going to close the roads where people using wheelchairs. It's very difficult to access those areas. And I'm wondering about that.
we really want to give them notice, appropriate notice. There's people that walk, there's people that are on wheelchairs, and also on the 10 as well, when they closed it, she didn't know about it, people didn't know about it. So that was more of her comment.
Closures that affected lot 10 and the access points to Historic General.
Okay. Yeah, that's a very good point. We did try to communicate effectively to the staff, but I don't know how much of that communication was extended to the community. So I think it's a very good point. There'll probably be more activity with the building out of the West Campus. So we'll certainly take that into consideration, work with the Wellness Center to try to do a better job communicating to the community, not only our staff and visitors.
Yes. I think, what other thing did you? In regards to we can get the microphone to you, just so that the people online can hear.
In terms of the route outside of the campus, so from the Union Station, is there any other stops you make along the way in the neighborhood? Do you have a map of that, or?
Yeah, there's only a pickup spot and a drop-off spot. So there's nothing in between Union Station and the medical center, and in either direction.
Got it. Is that something that could happen or no? In regards to pickup in between Union Station and like at key points where there's maybe there may be more population that may want to.
It's certainly something we can look at. We would have to balance that out with, right now it's only about a 10-minute drive at most. So we would need to look at that, as well as the impact that would have in the arrive time or depart time. There's a really small window that our staff in particular have between the matching the bus times and their start times. So there's not a lot of flexibility there, but we can certainly look to see how much flexibility there might be and what we could do.
Thank you.
And I wonder, since staff start at very specific times, could the routes change outside of those times? If you see what I'm saying, like starting at 10 a.m., for example, not starting at 7 a.m., which we understand everyone's on a very tight timeline, but medical appointments aren't at 7 a.m. anyway. But it's more for like community members to receive medical appointments, maybe starting at 9 onward. Maybe that might be an opportunity.
Nothing is permanent. And we know we need to adapt to the needs of our staff and patients and visitors. So I'm happy to get back with our team that operates the shuttles and see what changes could be made, taking into consideration, like you said, the clinic times in addition to the times that our staff is starting. I think there's another question.
Más que pregunta es un agradecimiento, la manera que
More than a question is, I want to thank you. We could found the information about the meeting with advertisement and banners outside. This is very helpful when they're closing a accessing route. I think it'll be very helpful to have this information outside with colors and very big letters, so we can see on certain dates that those accessing routes are going to be closed. Maybe. Thank you so much
for this information. The only way that she was able to get to this meeting was with the big signage and poster boards that were leading her to this room. And that is a great idea. In the future, whenever you're going to close a pathway or a street or whatnot, if you can do the same to put big poster boards with the dates that it's going to be in effect, that they won't have access to that walkway or pathway, that would help her a lot, as well as everyone else.
Very good point, and certainly keep that in mind.
Yes, I know, as much as we all rely so much on our phones and technology devices, in-person information, there's no substitute for it. Thank you so much for that point. That's a really important one. So we are definitely at time and a little past, but I want to give a really big thank you to all of our speakers today and to the wealth of information shared related to access to this campus and how do we improve it. I did want to make mention there was one comment in the chat David Galiviz, I don't know if you want to actually say it out loud or if you want me to just read your comment aloud. So I'll read on behalf of David. So David Galaviz, who works for USC, mentions that the USC CAC shuttles are open to the community and their routes are between the USC campuses and Union Station. They run every 15 to 30 minutes, depending on the route, and they are accessible to the students, the employees, and community members as well. So I'm sorry we don't have additional information, but we can reach out to David and see if we can get a flyer and some additional route information there. We'll take the information from this presentation about the routes related to the Los Angeles General shuttles, and of course, all of the incredible information shared by our transportation specialists today. Next meeting will be in April, on the Friday, the April 4th. And, oh, oops, sorry. Can you go to the very end of the presentation? Our next meeting is going to be Friday, April 4th. And we're very excited to welcome back some additional conversation of transportation at that time. We also take some words of advice and guidance from the members of our community about how to create better accessibility for this meeting. But mostly we thank all of you who came in person today, and certainly all of our attendees online. We're really excited to continue this conversation and dialogue with you every month. And just as a reminder, next one will be Friday, April 4th. 8:45 to 10:45 in this room, and also accessible via Zoom. So thank you so much for joining us today. Any closing comments or announcements?
This is Wayne Wassell.
Oh,
I'm looking at the I'm looking at the website for the hospital, and the bus service section is really outdated. There are lines that don't even operate anymore on there. Also, that map that you showed, that'd be nice if it was on the website too for people that want to access the hospital. I couldn't locate it.
Yeah, no, that's a good point. In addition to, but glad to hear that the USC shuttle is also available to the community. So certainly something we can add and maybe incorporate into our travel path so that staff and community are fully aware as to the access points. But yeah, thank you for that.
Yeah, it sounds like we have
my presentation so that you could probably have whoever updates the like the 71A doesn't operate. There's no more 620. There's no 378. 79 certainly doesn't. It's really old information, and you guys just change your name and everything.
All right. Well, we'll make sure that our public information officer, who I imagine takes responsibility for the content of the website, is given a copy of the presentation with highlights that we really want to emphasize some of the updated information, because we know that if it's been validated by you, Wayne, and validated by Kay, and validated by USC, that this is the current information. So we'll make sure to get that over to the public information officer.
Thank you.
Thank you, Wayne. Thank you for calling it out, though. Thank you for going on the website and doing a little bit of additional homework to point us in the right direction. Again, this is a collaborative effort, and we're here to just, work with each other to kind of raise the standards for all and create better accessibility for our community. So thank you, one and all, to our amazing speakers, and thank you again to the organizers who helped make this event possible. We'll see you again in a month. Thank you so much.